We welcome you to our presentation. We want to give you a better idea of how we can use big data to prevent crises and how we can contribute to a better world. So, between 1918 and 1920, the world experienced something called the Spanish flu. It had enormous death rates, and 50 million people died in only 2 years. So a pandemic like that can lead to a worldwide crisis. And in our modern world that's so globalized, it can really have an enormous impact on our economy. So there were recent events like the swine flu and Ebola, which concern us because they have pandemic characteristics. Actually, science believes that pandemics occur 2 to 3 times every century. The big problem that we have to tackle is that we can't detect them on time. So I'll ask the question, how does the future look like concerning the prevention of a pandemic crisis?
Well, our solution is Cenobit. We will be using an app as a main tool, and this app will be collecting health data. It is provided and run by the WHO. And as we want it to be used by as many people as possible, it will be free and it will be user-friendly. Well, let's look at this group of people. While using their mobile phone, their data is constantly being collected and sent to a server of the WHO. But what data can we actually collect? By using already existing sensors and functions of mobile devices, we are able to collect data such as body temperature, the sweating, the cardio, and the movements of the users. Even though this data will not give us 100% certainty whether a person is sick or not, it is a good indication. It can help to make an assumption. If, for example, someone has an abnormal high body temperature and tracking shows that instead of going to work as every day, this person is staying at home, this might show that this person is sick. Or let's take Hanneli. She's been to work as usual, but her body temperature is higher than normal. Even though she does not know yet, she might be getting sick soon, and thus being a danger for the environment.
So how can we make use of this big set of data? Let's assume Dr. Schneider. He has 3 patients who all show similar symptoms. Unfortunately, he doesn't recognize the danger of a potential pandemic because other people with the same symptoms haven't gone to him yet. However, the WHO registered 50 other cases in the same place and is now able to warn the population and take precautions, such as washing their hands regularly, visiting the doctor on time, and developing a treatment. And, if necessary, even taking heavier measures, such as closing schools. The data will be kept anonymous because of privacy. The only things we really have to know is age, gender, and location of the sick person.
However, we still face some problems. Many people in developing countries do not own any smart devices. So we could say we don't care about that because in a few years that will change anyway, and studies actually predicts this, that in 10 to 20 years, nearly everyone will have a mobile device. But we came up with another solution for these areas. By using drones with thermographic cameras, it is possible to measure the body temperature of the people filmed. So as you can see in this example. So we could hopefully be able to predict such diseases in areas like this, so slums of big cities or other developing areas as well. By all of this, we hope to be able to make an important contribution in preventing the death of many people. Yeah, thank you for your attention.